stream should now be live.
Oh. I guess I'll start my video then.
Hi, everyone. How you doing? I just got off a meeting with Sherry, and so we'll get, let's see, is everybody here? Let me see. Autumn's not on. Oh, yes, Autumn's here. She's just not showing her face. Autumn, are we expecting anyone else?
We're expecting Lisa.
Okay. Well, we'll just wait a minute and see. All right, I'm gonna call the meeting to order. And as you know, this is not my usual role. We still need a chair and a vice chair. And again, it's not a whole lot of work if you're the chair or the vice chair. You do generally call the meeting to order and make sure the agenda is followed. And when we're in person, it's much easier to tell if somebody wants to speak or not. But you all are going to just have to unmute when you want to speak, or just wave your hand and let us know and break in, because I don't want this to be the Diane Kuknio show here. Okay. So I do want to welcome a new member appointed by council, and her name is Sherry Stewart. And Sherry, do you want to tell the group a little bit about yourself, maybe?
Sure. So I came to Charlottesville in the early 90s, finishing university at Western Kentucky University. I worked at Charlottesville High School because that was the first job I could find with benefits. Finished my last class of developmental psych on the typewriter. It was gosh, what did we call it back then when we didn't have online classes? I don't know. Anyway, that was a long time ago. Left for the Peace Corps in 1996. I went to Poland, started to teach English overseas. I was in a few different countries up until November of 2005. I came back to Charlottesville from Thailand with a husband, immigrant husband, and 2 children. And I utilized social services benefits because you can't really convert Thai baht to US dollars. And I have been working for adult education, which was under the umbrella of city schools, but now is a part of the community college. It's called TJ ACE at PVCC. I'm an ESL instructor in the evenings. And I also have been working for the Charlottesville City Schools for about 13, I think it's 13, I lost count, years as the ESL. They named it special counselor. It's kind of like family engagement liaison between parents, families, teachers, and staff. So I work a lot with our refugee community and work with IRC and many of the organizations in town that support refugees and immigrants. And I'm happy to be here.
Welcome.
Thank you.
Yes, we are happy to have you. And you have a lot that you're bringing with you as a person to offer to this board and to our agency. So much appreciated.
And to the community, thank you.
Yes. Yes, yes. Okay. I don't know that we have any public on this call. Joe or Jeremy, I'm not sure which one of you is on right now, but do we?
We have 4 attendees right now.
Okay.
So if you would like to speak to the board, please click the raise hand icon in your Zoom webinar. Or if you're joining us via telephone, please press *9. Each speaker is allowed 3 minutes to speak. No one has their hands raised at this time.
Okay. Okay. All right. Did everyone have a chance to read the November minutes, which was our last meeting? Are there any changes or corrections to the minutes? Okay. All right, all those in favor of approving the minutes, please raise your hand. All right. Thank you. All right. I also, before the director's report, I'll ask for members' reports. Are there any members' reports today?
Nothing. I don't have a report, but I would love to know if there's going to be a difference in the, if not food stamp, SNAP benefits, if that's going to take effect quickly, or how you see that coming.
Yeah, I mean, it was that everybody was getting the maximum amount, but now there's an additional amount that's going to be added onto that. And that should be coming very quickly. So yes, so to speak, there's a new sheriff in town in the federal government, but that should be arriving quickly. So I don't have in front of me the exact date that it's going to be applied to everybody's benefit card, but it will. So, and that information has probably gone out to everybody that's receiving SNAP at this point. But I can't say that for sure because I don't want to say that without verifying it with my benefit folks, and I haven't done that at this point. Okay. Any other members' reports? We do still have, and Janet, I want to make sure you know this, and because I've been in touch with the person you had recommended to apply to the board to. We still have a vacancy on the board, and with May, we may have 2 vacancies on the board. So please, again, encourage people you know who you believe would be good board members.
Diane,
Yes.
we actually have 2 vacancies, so May would make 3.
Oh, okay. Okay. Because, I keep forgetting, Judy, you're just going and
just
going and
holding
going
them.
for us. That's great. Which, thank you. Thank you,
You're
Judy.
welcome. You're very welcome.
So, so please encourage. I know it's during these times, it's difficult for people to be looking at applying for boards, but it is something that we need to get those positions filled.
And please make sure they live in the city of Charlottesville.
Yes. And I think part of the problem with that is in the past, some councils, Councilor McGill, were not so strict about that. But yes, we did have a good applicant that was not a Charlottesville resident. That it has become a requirement at this point. So not at this point, but it's a requirement with this council. Okay. All right. Oh, excuse me. I diverted my phone here. Oh, okay. So I already have a benefit worker who has just come in with the comment to say the 16th is when the new benefit amount. So we actually have right now, one of the people that's listening in is one of our own benefit supervisors. So that, I can't see all the people, the public that are listening in, but that's great. That's great. Okay. Does that answer your question about the increase in SNAP benefits? Okay. I, as part of my director's report, want to say thank you very much, Janet, for your report to council. And I said, it's our report, but you were the person who reported to council, and you did a really nice job of that report. I know, given the pandemic and how infrequently we've been able to meet, I think that Autumn and Laura did a nice job of getting everything together that we requested to be in the report. And Janet, you did a wonderful job presenting the report to council. So I really appreciate the work that that all three of you guys did on that report. Were there any questions about the report at all? I mean, like, I know it went out late and you didn't have a lot of time to review, and we didn't do our normal 3 or 4 month review of the report before it went to council because we only had 2 meetings at the end of the year. So any questions about any of that? There were a couple things I wanted to point out in the report, and it really had to do with it kind of, let me see, I think I printed that report off today so I could have it in front of me. It had to do with the economic impact of social services just between, I just compared the last 2 years. So mind you, we really went into pandemic mode in March, which was at the end of the fiscal year. And that is when our benefit caseloads for applications just skyrocketed. And so in fiscal year 2019, the economic impact of our department was almost $91 million. And that was for a whole year, 12 months, okay? So it was $91 million, and that was fiscal year 19, which would have gone from July 1 of 18 to June 30th of 19. Fiscal year 2020, which went from July 1, 19 to June 30th, just June 30th of this past year, 2020, the economic impact was over $103 million. So there was about a $13 million increase, and that increase was mainly due to the increase in benefits. And so this is not all local dollars. Most of this is federal dollars. And there was a huge increase, very little increase in staff and operations. It went increase of $100,000, but all the rest of that increase was benefits. In fact, some of our things and our adoptions went up also. So there were adoptions payment increases, but we had 27 adoptions last year, which was the most we've ever had, ever, that we have records on. So moving children to permanency, and many of those adoptions, of course, not of course, but many of those adoptions were kinship adoptions with extended family members adopting children. Many of the people who adopt can get adoption assistance also, so those went up. But the great majority of it was in SNAP benefits. Just in SNAP benefits, I'll give you 5.1 million in 2019. And by June 30th, that 5.1 million went up in SNAP benefits to 6.4 million. So it was a 1.3 million more, and we'd only been in pandemic mode for a little less than 4 months at that point. I'm assuming that we will see an increase again this year. Also Medicaid assistance, even though the caseload didn't go up a lot, the payments went up a great deal with Medicaid expansion, and that went from 61 million to 73 million. Now those payments are going to medical providers for folks, but so that people have health insurance and can meet the needs. So that was something that I just pulled out this morning to check those numbers between the 2 years. And so do not be surprised again, the increase in local, and I should say this, the increase in from 90 million to almost $104 million total. The increase in the local funds was only less than $400,000. Most of that increase was all federal and state. That I think that was something that, we didn't really spend a lot of time on. People don't want to hear this on Zoom meetings on a report to council, and the council has all that information. But I do appreciate, again, Janet, the great job that you did with that report.
But
I,
council does, sorry to interrupt,
Yeah,
but
go ahead,
council does have this information because I think it's really important.
oh, yes,
And I'm
yes,
glad you're showing us the changes.
right.
It's really important. And I watched I was on the Zoom, so I watched it. I thought it was really good. And I like the new format that it's separate from the city council meetings.
Yes. That was much appreciated, Counselor McGill, that we didn't have to have a board member there until almost midnight to give a report. And so please make sure the counselors know that we think that's a great change, and maybe it should stay even after the pandemic when the meetings are in person.
Yeah, it's so weird. I can't even think about how we're going to start meetings again in the future once we can actually meet in person. I mean, I've only had 2 months before a pandemic hit, so in my norm.
Okay. The other thing is do we want to continue like this, not electing a board chair and vice chair until you have more board members on board? Or how do you want to go about this, folks?
I'm willing to do it, but I also feel like I'm a senior and there's some more, people who are out and about and involved. And so I'm willing, but I don't want to compete with anybody else. You certainly welcome.
When is the deadline to submit applications to join?
We're going to rely on our counselor for this one.
I was just looking this up actually, and I'm a little confused because I didn't think that we just appointed people to council in December, and then it's a quarterly normally, but on the website it says the deadline is the 20th January. They're posted right now.
Okay. And there's not a deadline on it?
It doesn't make, the deadline I saw doesn't make sense considering it's past the deadline
Oh, okay.
that I saw for February appointments. But the next round of appointments should be in March. And usually the deadline then is like a week or so before the meetings. So I'd say as long as people get in, mid-February, I mean, the next couple of weeks in particular should be fine.
Because the deadline is March. You see, the deadline said January 22nd, so there's some incorrectness somewhere.
That's, hold on.
What we're assuming, but we don't know for sure.
I'm going to the website. Hold on.
I would like to nominate Shayla as the chairman. I see a smile over there and I think she'd be fabulous.
If you want me to take it on, Shayla, I'll second that.
Rebecca's thumb was up.
Unfortunately, I'm starting a new job next week, so I'm not sure what my time commitment might be. So I will give it some thought, but I'll have to kind of get adjusted into my new role first before I can make that decision.
We'll give you time.
And I think for what it's worth, my 2 cents are that even if someone new joins the board, I don't think they would jump right into being a chair or vice chair. So it might make sense just to vote with the folks we have right now.
I think it's a good point. Yeah. So it's back to you, Janet.
Shayla, would you be willing to co-chair with me and we'll just do it together? And whenever you don't have time to do something, I'll pick it up.
Sure. Yeah, I would be open to that, definitely.
Is that okay, Diane?
Well, Shayla, would you like to be president and would you like to be vice president, Janet? And you'll pick up when Shayla can't be here?
That works for me.
Okay. So that's who we're nominating. And so let's vote first. on the chair, which would be Shayla. All those in favor, please raise your hand. Yay! It's consensus. Okay, for vice chair, all those in favor of Janet, please raise your hand. Can't see yours, Judy. Thank you. All right. Yay. Okay. So I'll get in touch with both of you so that we can see who will be chairing the next meeting. Okay. Yay, that's wonderful. Thank you both. I really appreciate it. Yes,
March
Rebecca.
5th is the deadline.
Oh, March 5th is the deadline for the next applications. Okay. Okay,
Diane?
so yes, Rebecca.
Just wondering, have you heard from Lisa Brown or LD Perry in a while? I see that Lisa's name isn't on our board list on the website.
Yeah, she is no longer on the board because of other commitments.
Okay.
And I'll just put this out to you guys. We have not been able to reach LD.
Okay.
If any of you have contact information that we might not have, but we have not been able to reach him. At this point with, and again, this is pre-pandemic stuff, but with council's notice that people have to make a certain number of meetings or they are off a board, LD would be off the board at this point. But it's just, we haven't at all had any ability to contact him, which I feel bad about. And I don't know the reasons why there's no contact information that we can get. But so I will talk to you about it, Sina, about it so that we can see what we should do about that. Okay. I mean, these are kind of extenuating circumstances. And he just may not have the technology, but you know, we don't get any, well, Autumn could speak more to this, but we can't get any email response or phone call or anything. So
I do know somebody who was in touch with him about another board he's on.
uh-huh.
So I will get in touch with them to find out how they were able to get through. And I'll
Fine.
see what I
Yeah.
can do.
Okay. Thank you.
Yeah.
Appreciate it. Any other members report stuff? I'm going to move on to director's report. I'll tell you that we are still chugging along here. And when I say chugging along, at full speed and a half, people are, you know, we are doing now most of our monthly visits with foster care children and our foster or our family preservation families. We're doing most of those in person at this point with PPEs, trying to do them outside. There are a few for medical reasons that we are not doing in person. Staff have been very good about social distancing, wearing their masks in the buildings. We are so appreciative of council and city manager's office still allowing us to do most of our staff to be virtually out of the building and keeping the building closed to the public at this point. And by the number of new cases we have, we are working around with people. We are taking applications by phone. If they don't have technology, they can submit paper applications. They can submit online. And again, we realize that, you know, there are many community members that don't have the option of doing it online, but there is paper applications we can give to them. They can fill out, or they can do an application over the phone. And it's working. I mean, people are doing the work. And again, we are very grateful. We've been able to get some technology stuff to make sure that folks are able to work from home. You know, I appreciate just the Zoom meetings in the beginning. I did not have the camera for a Zoom meeting, and it's much easier to be able to see people just like now. I really am very grateful for seeing all of you even if it's on a screen, it's nice. So we are doing what we need to do, keeping up with any updates. As you saw, we had a benefit supervisor on giving us an update about the extra money when it's going to be coming into people's SNAP. I call it a SNAP card, but it's an electronic benefit transfer card. I just can't. I'm amazed. I'm still amazed. We've got a great staff. And we've been able to fill some vacancies. And a few of our new hires are just really grateful to be here. And, like I said, one of them just this past week came in and told me the difference between where she was working before in a different locality and here. So that was good news. The news that I have different feelings about right now is I do want to let you know, all of you, that I'm going to be retiring. I know Council McGill already knew this. Next month will probably be my last meeting with you all. And I say this, and it's hard not to cry because it has nothing to do with what is happening in the city at all. I have been here, and some of you know this story, since July 1st, 1993. Actually, I started the week before, but I wasn't on payroll, but they gave me some comp hours for it because they wanted me to start right away. And I started part-time as the first accountant when the Comprehensive Services Act came on board, first accountant in social services, part-time. 20 hours a week. Quickly, it was 30 hours a week because I was also doing all the financial work for the department and the budgeting. And soon it was 40 hours a week, which I'm so grateful for because I was also newly divorced with 3 children to support. And then after that, I became Chief of Administration, the job that Laura currently holds. And then almost 11 years ago now, I became the interim director. And then once there was a new city manager, Maurice became permanent city manager. Then I was appointed permanent director of social services. So it's been a long haul, almost 28 years. And my original intention, I turned 65 last September 1st. And originally that's when I planned to retire. But I just couldn't walk out in the middle of this pandemic. But I don't even know if it's the middle of the pandemic now. I just don't know. But it is time. And it was a hard decision. And every day I wake up and I think, oh, one less day that I have to, I'm going to be able, I shouldn't say have to, be able to go into work. I was just talking with Laura this morning about, I don't want to have to turn in my swipe card and never be able to get in the building again. It's just silly stuff, but it's not silly. The people I work with are incredible folks. And I mean that for my department most especially, but also I have worked with amazing other people on department heads and counselors and citizens and other community partners. And this is a wonderful place to live and work. And, I just can't say enough about how much I've appreciated my time here and my time with the city and my time with my colleagues and with all of you. And again, the citizens, we have a wonderful, wonderful community. So with that, I just tell you, we were.
What is the date? What's the date of your last day?
Well, it officially or non-officially. I still haven't gotten my appointment with HR to get this straightened out, but I think my last day in the office will be early March, but so my official date will be April 1st. I originally had planned February 1st, but I can't even get things cleaned up in my office before then. So then I moved it to March 1st, and then I'll be using a lot of leave in March though. So I plan to be at our meeting here in February, but I'll be using a lot of leave up in March. Anyways, again, I will miss this board. I
We'll
will
miss you.
I will miss you a lot. And
It's so
and
fabulous that you're leaving the department in such good shape with such good people who have been proving by going through fire with the pandemic, and knowing what a great manager you are. I'm sure that you've been bringing people along and that you have other people in leadership positions. And I hope that they will step up and be as good and wonderful as you are. Thank you.
well, I do have amazing managers and supervisors, and staff, like it goes all the way down the line, and certainly I can't take credit for everything that's going on. There's no doubt about that. And it's all those people that are backing me up and making sure that the work gets done, and the people are and that we hire the right people and we try to keep the right people. And so, I don't want to take credit for all the wonderful things happening in this department, because sometimes I don't even know about them until after they've happened. So anyways, it is, so yes, Rebecca.
Sorry to see you go, Diane.
Oh,
We
thanks.
wish you the best in
Thanks.
your retirement. Is there a sense of what's happening after you, or who's happening after you?
I don't know the answer to that. I don't believe my vacancy has been posted yet. And I think, it may not be now until does Chip come on board in February? I could be wrong. I'm just guessing that John Blair doesn't want to do any of that when he's going to be leaving, but as far as I know, it hasn't been posted. As of last week, it hadn't been posted. So like I said, I've got a great assistant director behind me. Laura is amazing as our chief of administration. My chief of benefit programs, Mary Jane Skidmore, is wonderful. Chief of family services, Jenny Jones. I don't feel like if I walk out the door and a director hasn't been appointed yet, that the department is not going to be able to keep on keeping on. I really do feel like they will be able to do that, but that will be up to the city manager and city council to determine who that person is. So actually, I think it's city manager that hires the department heads. So
Yeah, city council.
Yeah.
Wouldn't be
Yeah.
involved in that.
yeah,
I mean,
So-
except for backing. I mean, this was one of the big reasons to hire somebody who was not an interim, is so that because most interims don't hire positions, and there's a lot of director level positions that don't want to be hired by an interim because they don't know who their next boss is going to be.
Mhm.
So
But again, I do not feel like social services is just going to kind of be putting the brakes on anything once I'm gone. And again, I'm very confident in our management team to keep all the balls rolling. They may not take on new things, which we're often out in the community taking on new things, and that may not happen right now. But they're very competent and very good at their jobs, and I have no doubts that that you guys will all be in good hands too. I will be talking, most likely Sue Moffett will be taking over these meetings as the person from the staff that will be doing this so-called director's report, if until a new director is appointed. So, and we had talked about going to every other month during the pandemic for our meetings. Is that something people still want to do? And if you would give me the ability to just come back in February, so I'm like more together as far as saying goodbye to all of you. It's like, I can't let go, you guys. I can't let go of y'all. So.
Diane, I just want to echo what everyone else is saying. I didn't have a very long time to get to know you, but I appreciate all that you've done. You have such a strong department under your leadership, and we really appreciate all that you've brought to this department and to the city. So thank you.
Thank you, Shayla. Appreciate it. All right. Happy note is May got the job that she was hoping for. We'll miss her dearly. I asked her if maybe she could join us for a few minutes today, but you know, she's packing to move and she's got 2 little ones, including the new baby. And
Where's she going? Wait.
Richmond, I think maybe VCU, but I could be wrong on that, for the hospital. VCU is a hospital, and I think I could be wrong, but she talked about, if you'll recall, you know, we had folks from our department come in and talk about trauma-informed care and resiliencies, and she brought all of that work and really brought it back to UVA's medical center. And then she also brought it to the state's nursing association or something, and she's been working on that. And I think that's one of the reasons VCU wanted her in their medical center, is some of that work. And I'm not taking credit for that. She took that ball and rolled with it, but she just got so excited about trauma-informed care and resiliencies and how to make those work when you're dealing with patients, and how you handle patients, and boy, is that important for medical care. You betcha, you know. So I believe that's where her job is, where she's going, but they're definitely moving to Richmond. And this morning she said they were packing, so she
Wow.
didn't think she could join us at this meeting, but yeah, so I think it's a job that she's just really looking forward to. So, and when she told us about it last month, I thought she's going to get the job. I just knew she was going to get the job. So all right. Any other things for today? Yes, Rebecca. Oh, you got to unmute. Okay, go ahead.
Can everybody hear me?
Yeah.
I just realized that I had something to add for the member report time. Where my husband and I are foster parents through CAF, and I just wanted to let folks know that we've been really impressed in the past year with it seems like a renewed focus on anti-racism and serving LGBTQIA kids. Every newsletter they have, there's information about those topics, and they're now requiring foster parents to view 2 interactive videos, one on anti-racism and one on LGBTQIA, serving LGBTQIA kids. So I think it's just a great move in the right direction, and just hope that DSS also can continue kind of ramping up in those areas. So just a positive report about CAF.
Yes, and thank you, Rebecca. And yes, that's part of our cultural competency and cultural humility training work, is also in both, well, it's centered around racism, but also about discrimination on every level, which includes racism and sexual orientation and religion and economics is also, and so we are continuing with that training. It's been more difficult for our staff to do some of that training, but we are doing a lot of it remotely at this point. And every time somebody has an offering, they send it out to all staff so that they can participate. And we also have some internal things that are happening. Of course, we're doing it virtually, but internal things that are being led by one of our service supervisors and one of our family services specialists who has been been leading a number of things also based on all of this. So, so kind of not on the same exact stream as CAF is doing, but we are doing the work in social services too. Because of course we work jointly with these foster families, and it's not just about our foster families and social services, it's all of our client base that we need to make sure. And I will tell you, I mean, I'm not going to name names, but we've had a few people that have posted some things on social media that of course other staff who happen to be friends with them or something have seen. And I've had some very serious discussions with a couple employees about things that they've liked or posted. And it is, social media is something that, oh, May has joined us. Yay! Oh, I'm so glad you could join us for a few minutes, May. I just said, we just talked about it a few minutes ago, and I said, I think she's way too busy to join us. Welcome.
Hi.
Welcome.
We all want to know about your new job.
Yeah. Can you guys hear me?
Yes.
Okay. Sorry. There's some baby music playing in the background. So I'll be working at VCU. I'll be split between the neurology office downtown and then working at the neuroscience, orthopedic and wellness center that's in Short Pump. So I was hired as a nurse practitioner in neurology. So I'm excited. I'll be
Wonderful.
different. Just, something new, a little nervous, but very excited about it. And I'll be able to participate in a lot of research. So I'm really excited about that.
Good for you.
You're going to have to
May.
give us updates. You're going to have
Will
to give
do.
us updates about your research.
Yeah.
Oh, it sounds like a great job for you, May. I'm so happy for
Yeah,
you.
Thanks.
Congratulations. But we're going to miss you.
Oh yeah, definitely. We, kind of went back and forth about having to do the commute because it'll be an hour to an hour and a half, depending on which office I'll be. And just with the baby and everything, I would be away almost 10 hours a day if
you
I
can't do that.
commuted. Yeah.
Yeah.
So we just decided to move, and my mom had retired and moved in with us. And so we needed a very specific amount of bedrooms, and we have a dog, so we it was really hard to find something that checked all the boxes, and luckily a house came available, so we just had to jump on it. So we technically get the keys on the 31st, but we can't actually physically move everything until the 6th. But it's just been kind of hectic because we're trying to pack this house, and it's just bananas.
Are you moving into Richmond or the outlying areas?
It's going to be in the outlining area. So we're going to be in the Short Pump area.
Great.
So I'll be like 8 minutes away from the office. So that'll be nice.
Oh, happy, happy, happy for you.
Thank you. So,
Well, thank you for taking the time. I know it's
know.
precious right now
I know.
to join us so we could at least see you and wish you
Yeah. Thank you.
well.
I hope we get to hear how things go. Sometime you have to come back or send an email and let us know how it's going.
Yes, definitely.
You can send that email to Autumn and she'll get it out to everybody.
Okay, great.
Good luck on this next adventure.
Thank you. I know it's bittersweet because this last year we haven't really been able to do all the things that we normally do around Charlottesville, and then you can't even really say proper goodbyes to everyone because we're not seeing anyone. So it's just been different, and hopefully we'll be able to come back, and we're not far away, but it's just different. Wanting to do all the things you want to do, and having like a good conclusion to your time here, and it just not happening. It's just kind of sad.
You're going to be,
Everything's different. Everything is different.
Yeah. But I mean, you guys have been wonderful to work with. I've learned so much, just being present and hearing so many different voices. So I will definitely take that with me. And hopefully be able to contribute to some services in Richmond at some point when I get my feet firmly planted on the ground.
oh,
So it has been wonderful, and thank you all so much.
thank you again, May. We will miss you. You will be greatly missed. And I know not just by our board, but by people at UVA and all the people in the community you've touched. So, and maybe someday you'll come back just to roam the mall when we're all open, and we'll run into each other.
Oh, definitely. That's what I want to do for sure.
So,
Yeah.
I just
Well,
have to commend you, May, on the incredible year you have, doing a dissertation, having a baby. I'm just in awe of your resilience.
Thank you. It's been hard. It's been hard, but
It's been superhuman, I think.
thanks. But I wouldn't have been able to get through all of it without everyone's support. So
It does take a village.
it does. It does. Even if it's a virtual village.
well, everybody's healthy in the family, right?
Hmm.
Good.
Everyone's doing
Good.
well. And I was
Good.
able to get my second shot. So that's nice. I was
Yay.
able to conclude that before I left UVA. But now, I know it's been hard because, like my mom is eligible to get the shot, and it's just nothing's available right now,
Yeah.
So I'm sure everyone's feeling it. Yeah.
Well,
But I wanted to, participate in my last meeting. So, carry on.
well, we were almost ending. I'm like,
Oh,
oh,
okay.
May's here. May is here. Yes.
Yeah.
So,
Mhm.
yeah, you will be deeply missed. And
I'd like to bring up one more thing before we go away. I was walking in the city the other day, and I came across a naked man walking on the other side of the street, and I called police, and they helped him. They were just incredible in helping him. He ended up eventually on an ambulance. So I'd like to commend the police somehow, Senna, if you have a way to they just responded quickly and were so sensitive to him and handled it so well. But it also brought to mind, like when we were starting the meeting, all the things, all the benefits that have been provided. Do we know of unmet needs in the community? Like there was a woman panhandling on the downtown mall, and I didn't have any money, but I asked her, what are you looking for, housing or what? I asked her, have you contacted social services? She told me she was on a waiting list for social services and that she did not have housing. And I don't know if, she was looking for money, obviously, but are there unmet needs that you know of?
I will tell you that there are unmet housing needs, but there's no waiting list at social services. We don't have a waiting list. And that I know there are unmet housing needs, although there, a lot of our male homeless right now are actually in a motel, and our female, as far as last I knew, which is much fewer, were still being housed overnight at downtown in the oh gosh, it's been so long. I forget the name of the downtown church.
The Haven.
The Haven, yes. So there are a lot of times when the homeless are outside like that. I mean, they're not kept in these places, they can wander, but it's some of it is a choice sometimes. And there have been people, you know, I've given away a few sleeping bags because there are people that just don't want to be in a shelter with other people. And a lot of that often has to do with mental illness. And so it's a hard thing sometimes to manage. But I can assure you, there is no wait list for social services. I mean, we can't provide housing. I mean, we can do for family and children, family preservation, we may provide a month of rent or something. We can't cover the housing for people ongoing. We don't have a program that does that. But
She might have also been talking about something that's called rapid rehousing, which does also have a wait list. There's only so much funds that the area gets. I know the city also supplies money to provide its own vouchers, and we've even allowed people to take those out. Those vouchers that the city is funding are now, if you can't find an apartment or a house in the city, people are being allowed to go into the county with them, even though the city is paying from its general fund dollars. There is a serious housing shortage. So there's also a lot of times Region 10 will have a wait list, depending on what kind of Medicaid you have or if you have Medicaid or not. Again, because there's not enough service providers, and Medicaid reimbursement has not gone up in 30 years that I know of. So the same amount of money you got reimbursed in the early 80s is the same amount of money you're getting reimbursed in 2021 for the same service. So the CSBs have had to really stretch things. Again, with what Diane said, there's times when people could go into Pacham or could go into the Salvation Army. There are some rules in both of those options that sometimes people choose not to follow, and they'd rather be outside. But then again, there's also, I'm not sure what's going on daytime wise with the library closed. I don't know how late the Haven is open. So daytime sheltering is difficult right now for people. And I've kind of been out of that for a couple of years. I've stayed in touch some. Oh, okay, thank you. Shayla just put in the chat that the Haven is open until 5 every day. So there is a daytime area for people to stay out of the cold. And again, knowing people who work at the Haven, I'm sure safety precautions are being taken very seriously. So years ago, at the Moore Center, there used to be something called wet beds, at least for men. These don't exist anymore. It became an issue with that people who were at the Moore Center for treatment, having people coming in who were too intoxicated to go into Pacham was very difficult for the people who were seeking more long-term 28-day, 14-day treatment. Pacham, I know, would take people when the police would call in the middle of the night with somebody who they found outside. So that the police were often a partner with Pacham of not wanting to take someone to jail. But sometimes that being the only option, if they couldn't bring them into Pacham, like if Pacham was full or something, and the police's option then is either leave somebody outside or take them arrest them so that they're sure that they're not going to get hypothermia and die. I do also heard that there has been an increase in heroin usage. And I know of at least one person who passed away recently due to this outside. I'm not really sure what, again, I haven't been deep in this. I used to be. And so I just hear some things from friends who are still in it. But it's definitely an issue that we're trying to figure out how to solve. And the key to that, the key issue to it is finding affordable supportive housing for people. And it's a housing first model. The problem is that's the initial cost to that is incredibly expensive, and it takes some time to do it. And as a locality, I just don't know how we can do it without federal funds coming in for it. And the federal funds have been getting smaller and smaller every year for years. It's yeah. This is what I did for 4 years working at Potcham. So it's just, it hurts that we still haven't found a good solution yet in our area. And I do know Potcham was struggling to find places because the congregations were afraid with COVID, and many congregations have elder members. So but there is some more, there's some hope coming down in the future. I don't know how public the plan is, but they are looking to hopefully find something a little bit more permanent in terms of a sheltering option. Especially with some funds that are being looked at. So I've got my fingers crossed. There's also a team of people at Region 10 called, it's PAX Path. It's a homeless outreach, specifically engaging in a way to start relationships with people, because somebody who has untreated long-term mental illness that's really usually very severe has a really sometimes hard time trusting people. And so the whole PAX model is about getting to know somebody over years to slowly help people work their way into getting assistance and help. And for any officers who you witness doing such a great job, I'm sure Chief Brackney would love to hear about her officers. And even if you don't remember their names, just, if you can give them the date and the time and what was going on, I'm sure she could figure that out. And, we always want to hear about the officers who are really, who get it, who are the officers we want other people to emulate, and who understand that a naked man outside is not a danger, is instead a danger to themselves, and to help talk them in to getting help is a great thing.
Thank you, Sina. All right, anything else, folks? Okay, well, this is our send-off for May. Thank you again, May. It's our welcome for Sherry. Welcome, Sherry. And I just want to say, please stay safe, everyone. We need you. Our community needs you. Your family and friends need you. So please stay safe. And what is that? Oh, your mask, your mask. I was like, what are you holding? Yes. And, I just regret that I just know we won't all be vaccinated and able to meet in person before our next meeting, but I look forward to seeing you in February. And again, there are openings on the board, so make sure that people apply. There won't be appointments again by council until March, but please get the applications in. As you know, we've got a wonderful new member of our board and we need a few more. So
So where can we find those applications if I want to try to scout some people?
the application is online. I don't know if they can pick up a paper application anymore, can they?
It's pretty easy to do online.
Yeah, but
and-
not everybody has the ability to do it
Yeah.
online. So that's why I was wondering if, do you know?
I have only seen the online ones where you go to the board and commission site, and then if you'll there's some links, and one of them is vacancies. And if you scroll down through them, there's like 15 right now that have vacancy. We need board members to apply. And one of
Okay, I just sent a message during the meeting to, I have a friend who is very connected and an important part of the Muslim community. And so I was like, do you know anybody from the mosque that lives in the city? So she said she was thinking of one person, so I just have to get that
good,
information to her.
Good, great.
Cross
thanks.
fingers.
Yes, Rebecca.
Just to Sherry's point, just now, I was just going to encourage folks to, if they're thinking about asking someone to apply, we could especially use the perspective of people of color. I think on this board, we lost 2, I think, Black members with LD and Lisa, and then people who've been impacted by, by the things that social services exist for. So.
Yes. Yes, because I always put it out to staff too and encourage them to encourage clients or former clients to apply also. So sometimes for our former clients, it's hard because they're juggling so many things right now. I think a lot of people may not be applying. I'm not just talking about our board, but may not be applying right now because it's not normal times where they know what their schedule is and know, they're juggling working from home and children or have lost their job or this or that. And it's just not normal times. So I still hope and think that, there are opportunities for folks to apply. So
I'm going to say something real quick. I think if someone probably doesn't have internet access, they might be able to reach out to the clerk of council and request an
A paper.
application be mailed to them.
Yeah. Good point, Shayla. Good point. So, all right, folks.
Okay.
Thank you again. Go forth. And we have a new chair and vice chair for our next meeting. Okay. And again, we were going to do every other month, but we'll look at February if that's okay with everybody. Okay.
Good idea. Good.
Take care, May.
Thank you so much. It's
Thank
a
you for
pleasure
joining us.
working with all of you.
Take
Bye,
care.
May.
Okay.
Good
bye.
luck.
Thank you.
She rolled over.